Our expert panelists joining us today are Dr. Richard Palmquist, integrative veterinarian and owner of Centinela Animal Hospital. He's an author, lecturer, and teacher. Dr. Christina Chambreau, internationally known homeopathic veterinarian, lecturer, and teacher. Joan Ranquet, animal communicator, teacher, author, lecturer, and owner of Communication with All Life University. And Brendan Golia, professional pet trainer, behavior expert, and owner of OC Canine Coaching. Welcome to Smart Pet Talk. I'm your host, Anna DeVere. In this special episode, we're excited to be joined by Dr. Barrie Sands. Dr. Barrie is an emergency critical care integrative holistic veterinarian who uses a wide variety of healing modalities from conventional allopathic methods to esoteric forms of energy healing. She is a journalist and published author of the book, The Stupid Things My Human Does, True Stories from the Animal ER, and has lectured nationally and internationally on both emergency medicine and holistic care. Dr. Barrie states, the need to bridge the gap between the mind, body, and spirit is an integral and important part in the healing and maintenance of health and well-being. And that is what we're going to talk about today. Welcome, Dr. Sands. What an honor and a privilege to have you joining us today. Dr. Christina, would you like to open this topic?
I consider you, Dr. Barrie, one of the leaders in in so many different areas. So today I want to sort of start us off looking at what is the difference that the mindset, the spiritual thinking, the emotional state of the pet parent, especially, throughout a pet's life, of course, but especially when something happens and they're headed to the ER, how can me as a pet parent work on my emotions to make my pet heal the best, the staff in the clinic work the best, as well as myself be able to listen better to what the veterinarians have to say?
Oh, well, Christina, that is that's a loaded question with many, many, many different ways of answering that. I think, the main thing that I'm hearing from your question is, how is it that in the face of crisis, when our animals are in an emergency state, can we maintain our emotional composure? I think that's probably the first level of that question. And because it has many, many different layers of how we can navigate through that system. But the easiest thing that one can do in the face of an emergent crisis is just take a pause and breathe. Take a breath, because it's in that space of the breath where you're going to sort of start to realign your physiology, because you're in a fight or flight mechanism and you're not helpful in that state to your pet or to your environment, or to the veterinarian that you're going to be trying to explain the situation to when you come into the ER. So, we can dive into that specifics, throughout the show, but the first and foremost is to stop and breathe, and if you have to breathe for about a minute, that would even be better. Because a minute is a very short time, but it's a very powerful time.
What happens during crisis is the body suspends time. It says, like, this accident has happened. I don't want it to happen. And one of the things that happens at euthanasia. It happens right after really big traumas. Is people stop breathing. They actually stop breathing, or they exhale and they don't inhale. And so it's really important physiologically to take a deep breath, fast in, and then slow out like twice the time it took you to inhale. That actually calms down your vagal nerve, which takes all that stress off the abdominal organs. And I see patients, I don't see that many emergency patients, but many of my patients are coming in with cancer or with organ disease that they've been told has a poor prognosis, which a lot of times it does. And sometimes we have to just take a couple breaths, and restart the time track with them. And we actually tell them just like that. I say, right now you're not breathing, you're trying to stop everything, or you're trying to control it all. Let go. Let's just exhale and then inhale and take a couple breaths. After euthanasia, we had a couple of very large people faint on me, and I'm not very big, so I can't hold them up. And after that, I realized I needed to do something, and we kind of analyzed it and realized what was happening was they stopped breathing. And then we just told them, this is terrible, and one of the things you're doing to adjust to this is to try and stop it from happening by not breathing. And it doesn't stop the event, but it does stop you temporarily until you breathe. So take a couple breaths with me. And it's really amazing. We haven't had any trips, stumbles, any of that kind of stuff with people since we started doing that. So I think for emergencies, that's really important.
And even by just saying the word breathe, in interjecting that into a conversation with a client that is in a very heightened emotional, sort of chaotic state, even if you just say, okay, let's just take a breath, it automatically reminds them that they're not breathing. And then they go, when they do that and they reset their physiology. And, we know that all it takes is literally about 6 to 7 breaths a minute will start to create your parasympathetic nervous system to come online and decrease your sympathetic drive, so that fight or flight will come down. And that's why we call it, the magic minute, because if you breathe 5 seconds in and 5 seconds out, 6 times, you've already breathed a minute, and your physiology is just already on the reset mode. So it doesn't take a lot of effort or time. It's just to remember to do that.
It's a big secret. I have to work that into my own clients when I'm training them. It happened this last week, and it probably happens at least once a week, where we're working with some pretty difficult behavior, reactivity, or stress. The dog is obviously, it could be vocalizing, and there's too much to manage for the person's skill set. They're brand new to this. They're exposed. They're probably being watched or listened to by neighbors. And it's really a lot of emotion they hold in, and they don't breathe. And it's amazing to see the change after about 20, 15 seconds of just the dog kind of checking in. Hey, look, something's different over here. What are you breathing for? You never do that, And it does help quite a bit. It helps with me. It's something I have to do quite often because I have Tourette syndrome. I don't tell a lot of people, but that it's a lot of focus for me to just control those tics sometimes. And so I'm powering through them, and to compensate, I have to remind myself to sit back and take a couple of deep breaths, let them slowly out. And it's amazingly helpful for me.
The whole emergency room is set up in such a way that is so startling and kind of stark. And I think it really puts people on edge, even just starting with the lighting. People running in.
Beeping.
Yeah.
Yeah. Well, the deeper aspect, the breath is just the beginning of that phenomenon. Absolutely. And the deeper aspect is to actually go into what we call coherence, physiological coherence, where your heart and your brain are actually in a unified harmonic conversation. And I can't say how important that ability to go into a state of coherence or to teach people how to do that is. And it's not as difficult as people think. I do that before I walk into a room to see a client, so that I'm in a physiological state of coherence. And because of that, my energy field is now being picked up by the client that is in the room. And so just by my presence alone, it's radiating out that field, which in studies that we've done, it shows that my coherent field will start to integrate with their biofields and create a coherence within them. So they don't even have to be even mindful of that. It's just the presence. I mean, we know that when we walk into a room and we're faced with someone who is in that very calm and peaceful state, we realize that all of a sudden we start to feel, calmer as well. And the opposite is true. When you walk in and you're in front of someone who's very agitated and anxious, you start to feel kind of jittery. So the beauty and the essence of the coherence and the harmony the simplicity of it is really getting in touch with your heart, because the heart has a unified frequency that is connected to your intuition, the field around you, the source of all energy fields, and the brain has two hemispheres, and so we're always in this dualistic state where we're right, left, right, left, right, left, pros, cons, and we're here a lot. And as soon as we kind of get these guys talking the same language, the right hemisphere and the left hemisphere, then that's the language of the heart. And then the heart will speak to the brain, and then your body will speak to the universe, and you will be in this kind of harmonic state with nature and all that's around you. And it's palpable. It's palpable to the people around you. It's palpable to the animals around you. So everybody just starts to calm down. And it starts with just, education and being the change that you want to see.
But see, what kicks you into that sympathetic nervous system, which is your fight or flight nervous system, is the fear of loss, or the fear of pain, or the fear of death. And so when a person goes to the ER, a lot of times they're connected to their regular veterinarian. That's the person they think knows about veterinary medicine. That's the person that has the relationship that's been established with trust and comfort and predictability. And now, especially during COVID, when people were sitting in the parking lot for 6 hours before a veterinarian would come out to talk to them, and they're heating up and they're getting more and more scared. That's all that's about, is getting out of that sympathetic nervous system, which is where all the crisis happens. You were attacked and eaten by a bear 10,000 years ago, and it was just like today. And the only thing is, it's just your dog's anal glands today. We're much better when we're present than when we're not. Everybody calms down, just as she was saying, and
so just
people
imagine
feel comfortable.
That all the people that are listening to All Paws Pet Talk TV right now, every one of you, what's the next two things they can learn in addition to taking a breath? How can people develop the coherence? Because not that many ER vets have it. So if you can have that coherence, if Kat can right now, in the next month, learn how to create that coherence, the next time she goes to the ER, or just to the vet, or to the groomer, or in a challenging walk through Manhattan with your dog. So what are the few, how can they get started other than breathing, Dr. Barrie?
Yeah, well, the first step is the breath, right? Because the breathing just takes you, it just turns the dial down, right? It gets you out of the moment. Then you have to connect with your heart. And when you do that, you can visualize your going into your heart space. And a lot of times, for a lot of people, where you touch your body is where your attention tends to go. So for some, it's easier to just put a hand or a finger or something over your heart, and your attention gets directed there. And then when in that breath, connecting to your heart space, just visualizing the energy that's flowing in and out of this space. The next step in order to get into coherence or harmony would be to find a positive, loving, elevated, emotional state. And that is very, very hard to do when you're in crisis and you're just in panic.
Well, especially because there's amorphic resonance, right? And so part of a lot of our calmness comes from being with our animals. So when they are in distress, that's starting to vibrate into our coherence.
Big time.
So we have to be what I always call the emotional leader then.
Mm-hmm. Right. Be the rock, be their guide, be their rock. Because they are our rocks a lot of times, and we rely on them. And so in those moments, they're relying on us. And so you have to just level up, and be the bigger person in that situation, really, and say, okay, I got this and I'm here for you. But you have to be there for yourself first. right? And so what I have learned to do is when I have been in those moments and I'm trying to recall a regenerative, loving feeling because you're trying to change your physiology out of fear into love. And so I have a little data bank of beautiful, beautiful memories that I have experienced in my life. And I have like 5 of them that I use, that I choose from. You know, I've already thought about them and put them in my crisis bank, so to speak. And so when I'm in those moments, I will I will tap into that memory because I know it's like, okay, well, I'm gonna choose the one when I was swimming with dolphins in Bimini, on the islands off of Bimini, and that was a completely elating experience for me. And then when I just pull myself back into that experience, the emotions flood back into my body because your body doesn't know the difference between a memory and an experience that you're having. And so my physiology is now back in the water with those dolphins. And from that grounded, loving place, now I can be present for whatever's in front of me from a different perspective. And you'll see that makes a huge world of difference. And it doesn't take long. It's in a matter of well, it starts off maybe minutes, but it can be seconds, you know, when you kind of get the hang of it and start practicing it. We know that stress is the number one reason for disease. You know, it's been known that it's, 70 to 90% of all disease conditions are based upon stress. And because of our field interaction, biofield interactions, and the space of energy that we share with our pets, they pick up on that always. And so the answer to that is a simple answer is yes. That is the case. We have seen, at least I have seen in the ER, many, many cases of animals coming in with stress-induced phenomenons. And it's literally, in most dogs, it's the GI tract is the number one affected. So they come in with vomiting, they come in with diarrhea, they come in with not eating. In cats, they tend to have urinary obstructions as a stress mechanism. So we've seen a lot of that. Also, seizures. Animals that come in with seizure disorders, their seizures will be triggered from stressful situations. So we'll see that. Not to mention heart failures. You know what? Because it's such a heart-to-heart connected phenomenon with stress. If you're prone to having any sort of pathology in the heart, whether it's dysfunction or arrhythmias, we've had animals with a very, very higher level of cardiac arrhythmias, those that have heart failures. So, all of those, there's a medical component to some of that, of course, as an underlying propensity to have that individual part of your body be affected. However, the stress level, when you have those catecholamines and the cortisol levels and the norepinephrine and all of those chemicals of stress that are coming into your system, the system has to react some way. And if it doesn't get channeled in other means, say you're sitting there festering in your moment because you're watching your owner, if you're a dog, from a dog's perspective, if you're watching your owner being upset, in panic, they're fighting with the family, and there's a high level of stress emotions in the group, the dog is just sitting there and he's taking all of this in. And if he doesn't have a place to put that energy, it goes into the physiology. And once it's in the physiology, it's going to find a place to manifest itself. And in Chinese medicine, we know that the GI tract has the essence of worry, of an emotion. And so anytime there's worry, then you're going to get upset with that, just in people as well.
This is Anna. I want to ask a question about overheating. So what would a pet guardian do with a dog that's overheating?
Well, the first thing to do is not let it go on too long.
Yeah.
And to start initiating cooling mechanisms before you get to an emergency room.
Mm.
I think it's always best if you know your animal and you know that they're going through a process of getting hotter. Sometimes you can feel it coming from their, radiating from their bodies, but especially in brachiocephalic breeds, they're much more prone to that because of their airways and their inability to exchange a lot of those, the flow to burn off the heat mechanisms. And so they get hot very, very fast. And so cooling them down is the best thing to start to do. And that would be a couple of ways, to take just a cold rag, a cold towel, put it over their head, put it on their feet. You can put their feet in like a little, some ice around their feet, because the hands and the head will start to create cooling down of the core. You don't want to throw them in an ice bucket. It's just cool water to put on them, and then take them into the veterinarian, because I've had situations where the owners thought that was enough, and then they let the dog home because they thought they did a good thing of cooling them down, and they were just going to wait and see what happened. But the problem is their body temperatures can get up to 109, 110 degrees, and that is dangerously high, right? And so the normal body temperature for dogs are, 100 to 102.5. Anything above that, you have massive changes in your physiology. Proteins start to denature, right? And things fall apart at these high temperatures. So they need one, even if the body temperature is coming down and they're not that high, you need to support the physiology, so that when the proteins are kind of getting online and the body's sort of figuring itself out, you have the support. And normally what we do in the ER is, we get an IV catheter in them right away. We start cooling them down in, fans and cold water putting on their bodies. And we want to cool them very rapidly, but when their temperature will start to drop pretty quick. And we measure that every 15 minutes, we're checking their body temperatures, because we'll notice that when their body temperature drops from, say, 108 to 103 over, say, maybe 20 minutes, 20, 30 minutes. After that, the body will start to plummet quickly. It'll have a tendency to go from, say, 102 down to 97. And you don't want to do that, right? That's also just as going from really hot to really cold. It doesn't lend success for the body to repair itself. So then that's when we would start actively warming and drying and getting this balance. We're helping the body reach its homeostasis. So we have IV fluids going in, and we have the cooling mechanisms, the warming mechanisms, and then all the other support that they need. So a lot of these animals do make it, they recover, but they are in intensive care for a good 24, sometimes 48 hours.
Yeah, and the critical temperature to remember is right around 105. So if they're below 105, 104 and a half, you need to get to the vet, but you don't have as big of an emergency. So you don't want people to go like, oh, my dog's temperature is 103, is going to die, and then go into a panic. If you're able to take their temperature and it's below 105, go to the vet, let the vet make the recommendations that they need to do. But if you're like, this happens a lot with seizures, you come home and your dog's having a seizure, one of the things you can do is take the temperature, because if it's between 105 and 108, that dog's got brain damage occurring really rapidly, and they need to get cooled off. They need to get to the emergency doctor, and you need to be able to tell them that when you get there. It's like, hey, I just got here, my dog's temp is 105.6, and I need to get him in and get him cooled off so he doesn't sit outside waiting or whatever for the veterinarian.
I mean, you'd be surprised how sensitive people are here to heat, and their unwillingness to take their dog out in 80-degree weather, where I'm at the beach. It's interesting. Like it does get to the point where pets aren't conditioned to it. They're not used to, I guess, to practicing cooling down and tolerating temperatures. So their owners are probably more sensitive as well. And if depending on the age of the dog, often puppies don't want to be out in any bright lights for an extended period of time when they're young. Or I've had certain breeds that are just seem to be known to like not tolerate heat at certain ages, or as the breed. Sometimes Australian Shepherds seem to be one of those for some reasons. They just kind of hide under bushes, and I had a couple Goldens do that as well. They get hot real easily.
Mm-hmm.
It's one of those breeds that I don't expect to lay on a bed a lot early on. They want to plop on a hard floor near a mantle. So it's something I am very considerate of, because it's it influences behavior quickly. And I can often say, your pet is not being stubborn, your pet's not being defiant. It's got a couple of things going on. We've seen it kind of go under shade, a couple of times, and it's probably not the best day for this puppy right now or dog to go on a long walk there. What it's saying is it doesn't feel like it. And so it's kind of dictating the path of the training that day, and we need to adjust tomorrow and maybe get out a little bit earlier. So yeah, I'm pretty aware of it. I try to tell my clients at the same time that this is a big factor for motivation, and if it's gonna present itself, then you might need to readjust yourself for the environment and move forward.
Mm-hmm.
And that's a really good point, Brendan, of encouraging people to stay in tune with their animals. And so those people who are walking their dogs, maybe in borderline temperature and are on their cell phones, aren't paying attention to what's going on with their dogs. And
the surface of the ground, yeah.
Right.
Yeah, we have to keep in mind the surface of the ground is really important. So we do like a 7 back of the hand, 7-second test. And I mean, if you can feel it before 5 or 3, I mean, you definitely have a big issue. But I'm sure I learned that from a couple of different people for different amount of time on the back of your hand. But it's pretty consistent. The pets will tell you. They'll see them walk on lighter surfaces versus darker surfaces, or choose grass often. And a lot of times you don't have grass options, or they're in a city and there's really nowhere to go. It's too hot. And it's just unfortunate that there's not a lot of other options for enrichment around outside, because they're in this concrete jungle or an area where it's just hard for some dogs to get used to that. And not everybody's willing to take the time to put on booties or train those or desensitize to those.
Mm-hmm.
Some people love it, and I love it when I get to help people with that. But everybody's got their own preferences of how they want to work the world with their dog.
Mm-hmm. And also, to tag on to that, it's yes, to intuitively understand your dog is really important, and to be mindful of the ambient temperatures. But I have met, many dogs who just want to play ball, and
That's true.
they will go to the point of exhaustion because they want to play ball. And the owner's like, oh, my dog is fine. He's still doing it. And the next thing you know, he collapses. Right. So
Right.
be mindful of their personalities, and their drive to keep going. We see a lot of problems with police dogs.
Yeah, I imagine.
Who are trained to just go, 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 go. These Belgian Malinois are like, they are genetic bullets, and
Right.
they will, a lot of them overheat. We see them coming into the ER.
I love all of this, and I wish there was a way to really teach people how to be in the emergency room. And I actually teach a technique called the scalar wave, and we really talk about it's really about going from chaos to coherence. And I'd love to hear a little more about what, is there a way we can bring this to the everyday person? Is there a way to get that chaos to coherence to happen for the average person, even though it's a very deep subject?
Yeah. So I think, that's it. When you start talking about scalar waves, and I love that you do that. We're going into the realm of the quantum world, to understand the things that are the unseen energies that are affecting us, and we're affecting it. So there's a universal field that we are all connected to. And this universal field, not only do we give input to it, but it gives feedback to us. And there's this constant self-propagating energy that is always moving through everything in the universe. And we're part of that universe. And our animals are part of that universe. And the nature and the trees and the worlds and the stones and everything that we exist within it is part of that. And what we have been, learning throughout these last, I don't know, decades about the quantum world is how to get in touch how does our consciousness get in touch with that field of energy? And one of the ways is through things like visualizations and something that we call intention. And the act of intention to mindfully produce a certain effect on a situation has great benefits to affecting your physiology and the biofield and the physiology and the biofield of your animals. So I guess the simplest answer, of how do we use these mechanisms in our state of crisis is, to take that breath, to get that emotional upregulation of feelings and physio and biochemistry into our bodies from the emotions that we're now choosing to have, and setting an intention around the moment, and like where you say, okay, my dog is in crisis. Say he just ran through a window and there's glass everywhere and the dog is bleeding and you're in a panic state. Take a breath. If you're in a panic and you're in a fearful state, remember a beautiful moment in time, a trip to Italy, your wedding, the birth of your baby, I don't know, just something that made you smile. And then from that place, the intention would be to heal my dog, to go to the vet, to take care of the situation. And all of a sudden you're going to be, you'll have an answer. You say, okay, well, I'm going to go get a bandage. I'm going to go get this piece of cloth that's laying there, and I'm going to apply pressure, and I'm going to tie a knot, and now we're going to take my dog and we're going to get in the car and we're going to drive somewhere. So there's a stepwise process that you go through when you're in a panic mode, and it's always dialing it down so that you can have your mind in alignment with a place of calm. And those are the moments where you will have your wisdom, the ideas that come into your mind will be the ones that will drive you to the place of success that you're trying to get to. Does that is that?
Yeah, no, I love it.
The kind of work that Barrie's doing in her books and the lectures she's giving are really opening people up to something that's so simple. No one believes that it could be that, but it is that. It's just being pause, be present,
Right,
view,
right.
and act.
Yeah, absolutely. And the challenge I have seen is I've had EMTs, people who are trained in emergency care, paramedics, that when it's their dog that something happens to, their brain just shuts down.
Mhm.
They lose all knowledge of what to do, and they're frozen. It's that fight, flight, and freeze mechanism. And so they'll freeze and not know what to do, even though
Well, and
they
they're all identifying, like the dog is them, like this is me that's
right.
hurt, right?
Yeah.
Yeah.
It's that fear base where they're like, oh my God, the love of my life is now in trauma. I don't know what to do anymore. Right. Because now you're functioning from an emotional space. And that's the place that we have to sort of evolve out of, and to understand. Yes, we all love our pets, and our heartstrings are being pulled, and we're afraid of loss, and we're afraid of death, and we're afraid of, all the things that go along with that. However, breathing into the moment and getting, it's almost as if you displace yourself from the emotional attachment that you have from your pet and become the neutral place where we operate from the best, where we're not all over, we're not high, we're not low, we're just seeing it as it is. And it's more like, Rick was saying that, yes, the glass is broken, the dog is standing there, there's blood everywhere, and I'm going to go get a rag and I'm going to wrap it around the dog's leg, and if the dog is all bitey and he's panicking, well, just, get a tie or something else and just wrap it around his muzzle, because nobody wants to get bit, and your dog doesn't want to bite you. He's just in a panic, and you can get bitten if they're in that state. So just tie his muzzle shut, and then, work on him a little bit, and then go to your vet, take the tie off. So let him pant and oxygenate better. But it's always coming from that place of calm.
But I think it is very important, as you've been mentioning, that imagine if everybody, when they first get an animal, goes to a trainer like Brendan and learns how to do basic physical exam, to do a capillary refill, to take the temperature, as we talked about with heat strokes. And they did that every month with their dog. So their dog was used to being handled, that they take an emergency first aid course. So they got the knowledge. And like you say, even with the knowledge, you may panic, but if you don't have the knowledge, you're going to panic more. Mm-hmm. And so I think it is really important to add in that piece of learning how to calm yourself with a background of knowledge that you've been trained in.
And when everybody's mom has taken the class from Joan, so that 2-year-olds go, "Mom, you're in chaos," then we're there. We're there then.
Amen.
To me, what I'm hearing after that whole conversation was, and stop me if I'm wrong, is that people might want to, the word acceptance seems to be the easiest way to approach crisis, and kind of saying to yourself, okay, this is what's happening, and just take a breath and understand that that's reality, whether you want it or not. The glass is broken, your dog is bleeding, they look stressed, you're in your home, and by the time you take a few breaths, you might have a much clearer understanding of what reality is and where everything is and how to triage this pet, versus fighting it, which is our natural instinct, or panicking. Mm-hmm. And we might have our emotions get in the way and take even longer to find, a source of, of help for our pets.
Yeah. And from that place of what I like to call just, mindful awareness, we start to enter a place of just observation, without the emotional attachment to the scenario. And then just from that place, you're able to just have higher levels of cortical functioning. You can think better when you're not in that heightened emotional state.
Thank you so much, Dr. Barrie. And thank you to our panel for this amazing show. Is there a way for our viewers to find you?
Yeah, I do have a website. It's drbarriesands.com. And there's a lot of information on the website on various different realms of different things, from human health to animal health to interspecies health. I also offer some classes in that kind of thing online to talk about emergency medicine, first aid, getting into coherence, that kind of thing. So, yeah.
If you would like to be a part of the conversation, you can email your questions to our website. This has been an incredible conversation, and it reminds me of the quote, "Until we extend our circle of compassion to all living things, humanity shall not find peace." We'll see you again soon. Until then, love your pets. Medical information obtained from our website or the live show is not intended to be a substitute for professional care. If your pet has, or you suspect they might have, an illness or other medical condition, you should consult a healthcare provider. The opinions expressed on this TV program are not necessarily those of Smart Pet Talk, this TV show, or their sponsors. For all questions or info on sponsorship, email us at info@smartpettalk.com or visit our website at smartpettalk.com.